Hi guys, this is 20 OBG instruments under 10 minutes. Very high yield for NEET PG and INICET. These are the only instruments you need to know and you need to learn to identify them. Let's go 10 minutes. First instrument is Sim speculum. You can identify this from the curved wall and it is used to retract the posterior vaginal wall, and once you retract it you can visualize the cervix and vagina. It is used for many operations, many procedures like DNC, vaginal hysterectomy, also for pap smear and IUD insertion. This instrument is Cusco self-retaining speculum. It is a PYQ INICET November question and it is self-retaining. That means once you insert it in the vagina, it stays open on its own. You don't need to hold it open. And because this instrument is very compact, it cannot be used for many surgical procedures. This is overt speculum and it is a groove that runs along the handle to drain the blood. It is an overt speculum. It is anterior vaginal wall retractor. It is used with because sim speculum is for posterior vaginal wall, anterior vaginal wall retractor is for anterior vaginal wall. And this instrument is valcellum, and it is valcellum. You see this teeth, it has teeth at the end of the blades. It is used to hold the anterior lip of the cervix in a non-gravid uterus. In a pregnant uterus you can't use valcellum because pregnant uterus is very soft. For a non-gravid uterus you can use this to hold the anterior lip of the cervix. What is this instrument? It is a sponge holding forceps, and check out the ends. It has these serrated ends. That is how you identify it, and it can be used to hold the sponge or gauze, very commonly used for painting the vagina with betadine or painting the abdominal wall. And in this case, sponge holding forceps is used to hold the anterior lip of the cervix in a gravid uterus. Why? Because gravid uterus is soft and it has no teeth. It has these serrated ends. What is this instrument? It is an ovum forceps. Ovum forceps, why? Because it has, check out these holes. That's how we recognize it's an ovum forceps. Why is it used? It is used to remove the products of conception or retained tissue from uterus after abortion or delivery. And also remember, there is no catch lock. Here there should be a bar which is absent in ovum forceps. So these holes, and there is no catch lock. And here also you have this an area for a tubular structure. So this could be a Babcock's forceps. Why? Because it is used to grasp tubular structures like fallopian tubes, intestines or ureters atraumatically, because the tubular structures go inside through this area. What is this instrument? It is green Armitage forceps. This is also an INICET May 2021 question. You can identify this by these flat ends, and it is also used in LSCS. Green Armitage forceps. Identify this retractor. This is Doyne's retractor. It is also INICET May 2021 question. Let's go through other retractors. Okay, this is Cerny's retractor. You can see the Z shape. This is Deaver's retractor for liver, smooth shaped. This is L shaped as Langenmann retractor. This one would be Morris retractor, and this is Doyne's retractor. Identify this instrument. It is Alice forceps. See this end? That's how we recognize it's an Alice tissue forceps. It is also PYQ. Identify this instrument. There's a BP handle. What is a BP handle? Bad Parker hand, BP blade, BP handle and a blade. Bad Parker blade, also a PYQ. This instrument is quite rare. It is a Shirodker forceps. This was one of the options in a PYQ. So it is a uterus holding forceps. So it's almost like a namaste sign. So Shirodker forceps, uterus holding forceps. This is very simple. Hegar's dilator. Hegar's dilator. Hegar's dilator, it is used for serious cervical dilatation before uterine procedures such as dilatation and curettage, hysteroscopy, suction evacuation. It is a Hegar's dilator. What is this instrument? It is a uterine sound. It is used to confirm the position of the uterus and length of the uterocervical canal. What is this instrument? It is manual vacuum aspirator. It is used for the evacuation of the uterus in an MTP done during 6 to 12 weeks. It doesn't need electricity. Around 600 millimeter Hg of pressure is needed. Karman's cannula, also used for MTP for suction evacuation. In India, it's also used for endometrial sampling. This is a Pippel's aspirator, Pippel's endometrial aspirator, also used for endometrial sampling. What is the use of instrument given below? Identify this instrument. Is a Leach-Wilkinson cannula, and it is used to push the dye into the uterus in a hysterosalpingography. So hysterosalpingography is the answer. Leach-Wilkinson cannula. This is a uterine curette. Notice that it has a sharp end and a blunt end. The sharp end is used for sharp curettage to obtain the endometrial tissue and to remove the functional layer of endometrium. That's how it controls the bleeding. And the blunt end, it is used in a gravid uterus, like for an incomplete abortion. This is Bonney's myoma screw. In a fibroid or myoma, you enter the screw and it provides a traction during myomectomy. So yeah, that's the end of 21 questions.